Hi, this is Joe Gregory, Vice President of Marketing at Orbograph. Last year we partnered with South Nassau Communities Hospital in implementing our Orbograph Healthcare Payment Automation Center, or HPAC. South Nassau Communities Hospital has implemented our system across their enterprise, processing explanation of benefit forms, EDI 835 payments, correspondent processing, and denials management. Let's hear from the folks at SNCH.
Hi, my name is Abdul Razak. I'm the Senior Director of Patient Financial Services at South Nassau Communities Hospital. South Nassau Communities Hospital is a community hospital located in Oceanside, New York. The hospital provides various services such as orthopedic surgery, gamma knife services, radiation oncology, computer-assisted surgeries. The revenue cycle process at South Nassau Communities Hospital is no different from any other hospital for the most part. It starts at the pre-scheduled process and it ends with the collection of the revenue. Our healthcare payment journey here at South Nassau has been a rough one. 14 years ago when I started here, everything was posted manually. We were able to eventually get the post Medicare, Medicaid, and Aetna electronically. Any given day, 95% of our claims are submitted electronically. When those payment comes in, only approximately 55% of those are posted electronically. Our goal at South Nassau is to post all of our payments electronically to get rid of all the paper EABs and to reallocate those resources that we intend to save to other positions where they're much more needed. We're using Orbograph Healthcare Payment Automation Center to process EOBs, and we expect to eliminate all of the manual EOB posting.
My name is Christine Kasub-Zoller. My title currently is Financial Information Systems Manager at South Nassau Communities Hospital. We are a 435-bed acute care facility. I am also the president of the NTT Data National User Group. I am in charge of the entire revenue cycle system as far as IT is concerned, working with all of registration as well as patient access, and I take care of the billing systems on the financial side. So the Orbograph HPAC solution is a cloud-based solution right now that South Nassau is using to convert our paper EOBs over to electronic 835s. The Orbograph HPAC system is also an electronic content management system that allows the users to be able to pull up the image of an EOB, can also pull up the 835 itself. They can pull up any denials and any correspondence that are sent over into the cloud-based system. The Orbograph HPAC solution works well with our Tripwire system because Tripwire only allows our users to go onto secure sites, and being that the HPAC solution is a very secure site, the users are able to get to it, and it was easy to implement and integrate throughout the entire hospital. South Nassau was investigating different vendors to be able to convert our EOBs into an 835. We did our due diligence and found that Orbograph was very HIPAA compliant, and that is a very important piece for South Nassau as we get audited yearly, especially the IT department. It also shows that the electronic file is a lot more secure than a paper file, because when you have a paper file, it can be floating anywhere and anybody can pick it up at any time. But when you have an electronic file, you have to use your specific login and password that is given to each person uniquely, so that only they can look up the information and we can audit based on who was looking up the information on a particular patient. Due to the auditing capabilities in the HPAC system, it helps us with our internal audits for corporate compliance.
One of the technology that Orbograph has brought to us is the reassociation of EFTs and ERAs. In the past, we used to reconcile checks and remittances manually, and this is done 5 days after the end of the month. With the reassociation technology, we're able to reconcile the ACH with the 835 on any given day. In healthcare, it's expected that you're going to receive numerous types of correspondence on a daily basis. They will range from rejections to requests for medical records to informing you that a hospital stay is covered. You can receive thousands and thousands of these correspondence on any given day, and you have to get these correspondence to the right source so they can be worked promptly. Otherwise, you can lose revenue.
The correspondence information is converted over to a zero-pay remittance file, which is then imported into our HIS, goes into the comments section of our HIS system, which allows us to pull up any kind of information for reporting purposes based on either an account number or a patient name.
My name is Julie Hubbard, Supervisor of Cash Management and Correspondence at South Nassau Communities Hospital. My responsibilities are maintaining the cash posting unit and the correspondence unit. The cash posting unit is responsible for all the checks, all the electronic funds that come into the hospital and get posted manually to the patient accounts. The correspondence unit is responsible for entering notes in the system for all correspondence that comes in from either third-party insurance carriers or that is patient-related. Last year, we began using Orbograph to electronically post our remittances into the Optimum system. This has greatly benefited the department as it cuts down on keying errors and allows the remittances to be posted accurately and timely. It also electronically posts notes to the system, which is very beneficial to the payment adjudication area.
In the past, when these were done manually, we were backlogged at least 3 weeks. With the use of Orbograph, we're only backlogged 1 day, and that's the time it takes for us to send it to Orbograph and to get it back. In the past, we've used paper remittance to process denials. Currently, we're using Orbograph HPAC, which is their electronic content management system.
My name is Iris Rodriguez. I'm the manager of the Payment Adjudication and Denial Management Department at South Nassau Communities Hospital. The Orbograph system has really helped the Denial Management Department. We easily access the denials now that Orbograph is automatically posting the notes into the system. It takes a matter of seconds to pull the correspondence from the Orbograph system. Previously we used to pull through drawers or scroll down through files, and now the time has really been cut down. And also we can address our denials timely now. Since previous to Orbograph, it used to take about 3 weeks for us to get the denials or to have the denials logged into the system. So it's been a major, major help to us.
The Orbograph technology has benefited us tremendously. We are working more effectively and efficiently right now. We have decreased the paper in the correspondence unit. We have reallocated resources from the correspondence unit. We have created more 835s from paper EOBs. Our denial process is more streamlined and more effective, and as a result, we are receiving less denials from untimely submissions.